So thank you everyone for joining us today. I'm Dr. Sean Wilkes. I'm the Vice President of the Society of Uniformed Services Psychiatrists, the APA's district branch for the U.S. military and the Public Health Service. And I'm also the division psychiatrist for the U.S. Army's 25th Infantry Division in Hawaii. And with Veterans Day around the corner, I think it's important to have an open conversation about mental health. So today we'll be focusing specifically on veteran mental health. And if you have any comments or questions you would like asked, please add those to the chat. And I'm joined today by my fellow panelists who I'm going to let introduce themselves.
Good morning. This is Dr. Erin Fletcher with Wounded Warrior Project. I've been with Wounded Warrior Project for coming up on 10 years in our Chicago office. I have my doctorate in clinical psychology and have a little over 15 years of experience working in the mental health field with adults and, specifically veterans. And I'm coming to you live from our Chicago office. Really happy to be here.
And Richard.
Yes, and hi, my name is Richard Dorr. I am a OEF-1 veteran from the U.S. Army. I've been out of the military since the 2008 timeframe. Actually, I've been a Wounded Warrior participant in some of their programs, and that's why I'm here today to kind of share my perspective on what a veteran is kind of forecasting and having complications or issues with in the mental health kind of arena.
Well, thanks both for joining in on the conversation. So as a psychiatrist, a topic that comes up a lot is how are veterans' needs unique when it comes to mental health? And in my experience, the unique stresses and exposures associated with military service often impact a lot the types of challenges that veterans face during and then after their service too. And of course, the quintessential example is exposure to significant psychological trauma in combat or otherwise as a result of their experiences and leading to things like post-traumatic stress. But in a lot of service members, in the case of a lot of service members, they also endure a variety of other conditions like depression or other mood disorders, traumatic brain injury, substance use disorders, sleep disorders. And veterans come to the table with a host of experiences that can impact and can sometimes result in a mental health condition. They're often required to perform difficult, arduous, dangerous tasks under high pressure, like in really highly austere environments, and they willingly and repeatedly place themselves in harm's way. And they're often separated from their families and social support networks for extended periods of time. And these are experiences that can be really taxing physically, mentally, emotionally, and their effects can lead to a lot of challenges and conditions along the way, some of which I already mentioned. And when doctors and therapists really take the time to understand veterans' lived experiences, it can help a lot in finding the most effective ways to help them. But Richard, as a non-medical professional, I'd love to hear your thoughts on the topic about what unique needs and experiences veterans bring to the table when it comes to mental health.
Yeah, I think the unique needs come from our baseline training that we receive in the military. We're kind of told to just let it go and it's normal. These feelings are normal, and you just kind of push on. And you come to find out when you get out of the military that those feelings aren't normal, and that people that experience these are very few actually. And we're kind of told to repress these feelings and just move on with our lives, where it's not healthy to do so. And speaking from my own experience, it takes a very long amount of time to shed those early onset rules that we've been given and to open up. And that is our biggest thing, is just not being able to open up to others. And I think you yourself, as being a service member yourself, can probably attest to that. And then also being in the medical aspect of that, you kind of have that double-edged sword of how do you feel, or what do you say, what do you do aspects.
Yeah, Erin, what are your thoughts?
I would agree with two of the major points that you brought up. Richard, you just mentioned that it's difficult to seek treatment when you've been told for so long, that this is something that you should be able to handle, that this is something that you should be able to overcome. And then finding that willingness to open up to a provider takes an incredible amount of strength. And so I think what's unique with treating veterans is ensuring that as a provider, that you've taken the time to become kind of competent in military culture. You don't want to have the veteran have to explain to you in your first 3 sessions all of the acronyms, this is what this means, this is, where I was. We really want to have kind of a foundational understanding of those unique challenges too, Dr. Wilkes, that you had identified. And I think that's really important in building that therapeutic relationship and starting to make progress towards one's recovery. And I go ahead.
I was just gonna say, I was wondering if you might be able to talk a little bit about the barriers to care that you've seen.
Yeah, absolutely. And I think, one of the biggest barriers that we've seen is what Richard talked about, this kind of idea that particularly when faced with mental health challenges, that these aren't as significant as physical injuries, that seeking support for mental health challenges is, again, not as important or aren't as worthy, I should say, as physical injuries. And we know that that's, not the case. Coupled with this idea of stigma surrounding mental health treatment, that these are things that you should handle on your own, that there's a lot of shame attached to seeking mental health treatment. It can feel very isolating. I don't want to reach out and say that I'm struggling. I don't want people to think that there's something truly wrong with me. And it really can be incredibly isolating. And we know that isolation can be dangerous. Richard,
Yeah.
I was going to say, Richard, is that something kind of that you've experienced or?
Yeah. When I first got back from Afghanistan, I was still active duty military, and the guys who originally came out and said that they had issues were labeled and kind of ostracized within the unit. And fast forward 10 years, and I'm one of those guys, I feel like. And you have that self-shame, feeling of inadequacy, feeling of less of a person, because you can't handle the same things that you maybe went through 10 years ago. And then the just unknowing of why am I having these feelings now versus when it first happened. There's so much in my life that changed, and I thought I was in a better situation, but it actually turned out to be worse. And then having to re-explain all those things to multiple different therapists because you either don't fit one that fits your culture, or you kind of get bounced around a little bit through private and VA because you're trying to find somebody that you can talk to on a weekly or bi-weekly time frame, and either cost, location, or even just personality conflicts just are there, and you feel like you kind of start to get lost in the shuffle of the medical system, which then leads you to not show up for meetings and things like that as well too, which then just compounds my issues. And so I end up with feeling worse and worse about myself during the times, and then you start looking to alternative therapies, and some of them are good and some of them are bad. And some by therapies I mean like going outside of medical treatments and going towards not so healthy alternatives.
Yeah, I think you both point out some really, really major barriers to care, and really you highlight 3 of the big ones that a recent study in the Rand Corporation identified, the 3 main barriers to care, and you pointed out all 3 of them. So one being social barriers, right? The stigma associated with seeking mental health, organizational barriers, the inadequate cultural competency, not enough training from the clinicians, and just the general shortage of mental health clinicians, and then the logistical barriers of difficulties finding a clinician, making appointments, getting to your appointments, that sort of thing, and all of these kind of get in the way. I'm wondering, so what are some of the strategies to decrease the stigma and decrease these barriers to mental health among the veteran population? Erin, do you have any thoughts on that?
Yeah, absolutely. I think it starts with conversations like these ones. I think that we really have to strive to have mental health injuries, mental health challenges be on the same level of conversation as talking about somebody with diabetes or high cholesterol. We have to reduce that shame surrounding mental health issues, and really, work to build this sense of community around mental health challenges. That it's not seeking treatment is not a sign of weakness. It takes an incredible amount of strength to raise your hand and say, I'm having a hard time, and this is not something that anybody really can or should have to go through by themselves.
Yeah, and I think there's a lot of initiatives out there, a lot of attempts to try to cut through the red tape, so to speak, and try to make access easier. Some of the most promising are to allow easy access to mental health through primary care. There are vet centers, and community-based outpatient centers, counseling centers that provide specific services to veterans and their families, and active duty service members. There's peer support counselors. That can also be a life-saving portal. Richard, I'm wondering if there are any resources in particular that you found that helped kind of cut through some of those barriers, or anything that you found that was particularly useful.
I went through a very long period of finding things that did not work, from my local vet centers to the VA hospital to going after private care, psychiatric centers, and things like that. Not to be a shameless plug, but Wounded Warrior, actually, I reached out to their resource center, and they helped me with the Road Home program in Chicago. And this was in the last year, which was a huge help, because I found out that some of the stuff that I was experiencing, I wasn't the only one. I can talk to my local veteran friends that are here, and you're gonna say, oh yeah, I'm going through it too, and things like that, but you really don't want to open up to your friends that you see every day and have that stigma that I can't be, I'm not as well put together as they thought I was. So having those resources where it's somewhat anonymous, where I can talk to somebody for an hour and then just leave and kind of work on myself from there was invaluable. The peer support teams that Wound Warrior has been putting together as well too has been very helpful, with some of the local people that I've seen as well too. And I know that those systems are growing, which I think is a resource that a lot of veterans can probably go to, where again, it's not going to cost them anything, potentially be in their backyard, if you will. And then, from there be able to build on, other relationships and other programs that might be that they'll hear about through just like the grassroots or word of mouth kind of areas as well too.
So it sounds like the peer support and kind of group approach was really what was most useful and helpful for you. Is that right?
It made me think that, I'm not by myself, and that was a big portion of it, is that I was feeling so isolated. I'm located in Wisconsin, and there's not a lot of veteran military population that I can reach out to, active duty and things like that. And so I was really feeling like I was the only one. But as I started to talk to some of the other Wounded Warriors and staff and things like that, I found out that I'm going through some of the exact issues that other people are too. And so it kind of normalized myself, and I wasn't feeling like I'm the outcast, or I can talk to my family a little bit more. Still, things that I struggle with today is just talking to people that have known me for a very long time about my issues and things I may never get through, but at least it's stuff that I can, they know I have issues, they know I have things I'm working on, and they know I'm safe, and that's the important thing.
Yeah, the social connectedness and that sense of community is really, really important. One of the easiest things to go missed and to go overlooked. I'm really glad you're able to get that help and assistance from Wounded Warrior Project. Now, I just wanted to shift gears a little bit and talk a little bit about moral injury. So that might be a new term to some people. Moral injury refers to the damage done to an individual's conscience or moral compass as a result of acting or witnessing behaviors that go against your values or moral beliefs. It's not an official diagnosis, so to speak, but it's been proposed to describe some of the suffering that veterans experience when they engage or observe acts during combat that violate their beliefs or about their own goodness or the goodness of the world or their conscience in general. So Dr. Fletcher, I'm wondering if you might be able to talk a little bit about your experience with addressing moral injury in practice.
Sure. And so I think you bring up a great point, that it's an aspect, I think, that can contribute to these mental health struggles. It can contribute to, symptoms of post-traumatic stress, and really looking at how witnessing or having to take part in, as you said, those actions that really kind of violate your moral compass, can just, foster that increased sense of isolation, that if people truly knew, what I had to do or what I've been through, that there's really no coming back from that. And I think, as Richard pointed out, in, formal mental health treatment, when you can open yourself up to talking about those experiences in a very safe and non-judgmental space, to know that others have experienced similar things, and really finding a way to bring some of that non-judgmental acceptance to, these are, actions that I had to take, but that don't truly define me as a person moving forward. And that's not always an easy road, but certainly one that's worth walking.
And I was wondering if you could also talk a little bit about resources. And I know, your organization in particular has some great ideas and great resources. So could you talk a little bit more about that?
Oh, I'd love to talk about the resources that Wounded Warrior Project has to offer. And so I'll start with, Wounded Warrior Project has really committed to taking a very holistic and comprehensive approach to wellness overall. We have programs and services designed to address one's physical health and wellness, one's mental health and wellness, their social connection, and their financial wellness, looking at, finding employment, seeking benefits from, the VA that they're entitled to. And so I'll speak kind of more specifically for our purposes about our mental health programs. And we have our mental health programs and services structured on a continuum of support that's really designed to meet the warrior where they're at in their unique recovery. This is not an instance where we're going to take a cookie cutter approach to treatment that, everybody, comes in through this doorway and they receive, this recommendation for this type of treatment. We're really looking to have a conversation with our warriors, find out where their challenges are, and look to meet those challenges as best we can. In one of our signature mental health programs, Richard talked about, as he mentioned, going through the Road Home program, which is part of Wounded Warrior Project's Warrior Care Network. And this, just briefly, is Wounded Warrior Project's partnership with 4 academic medical centers across the country that provide 2 weeks of intensive mental and brain health treatment to veterans at no cost to them. In these 2 weeks, veterans, experience over a year's worth of therapy. They're going through this program in a cohort, as Richard said, really being surrounded by people that really get it, that understand what you've been through, is, incredibly helpful in the recovery process. This program utilizes the gold standards of treatment for conditions like post-traumatic stress. We're using cognitive processing therapy, prolonged exposure, coupled with mindfulness and meditation, coupled with, physical health and wellness, nutrition courses. We bring the family members, as we know that, no warrior, is an island. We want them to go through with support. And this program, is national, so it's not based on where you're located. It's based on, what is best going to meet your needs. So that's our Warrior Care Network. We have programs that provide telephonic emotional support on a weekly basis, which is a great kind of introduction to some accountability and some goal setting and that mental health support. We have our Project Odyssey program that is a 12-week program with, again, goal setting and accountability that starts with an adventure-based mental health workshop, knowing that not every veteran wants to start with traditional kind of outpatient therapy 1 hour a week. This is a way to reach those individuals. And then we have partnerships with organizations, again, across the country that provide outpatient mental health, mental and brain health services to veterans and their families, again, at no cost to the veteran themselves.
So, Richard, I was wondering, that was a lot. Thanks for sharing all of that. I mean, there's so many resources available through Wounded Warrior Project. And Richard, I was wondering if you had any specific tips, any additional tips to veterans or their loved ones as far as good resources that you've found, or the most effective paths that you've observed for getting help or mental health care.
My personal take on it has been being kind of connected within Wounded Warrior Project has been very helpful. You know, each person, each veteran that I meet at each event that I've been able to attend, or each program that I've been able to go to, I get a little bit of knowledge or a little bit of a referral from each person because of all the different programs they've been part of. And then, you know, this program sent me to this program to be able to give me this information. And it just builds this large network of available, help that is out there that you walking in that door, I didn't know. So it just grows and grows and grows. So having that connection to other veterans, I think, is the biggest thing, because, we all can commiserate together, but we could all help each other out, immensely by just, talking. And I think that's what the biggest thing of, mental health is about, just talking about it, because if you don't talk about it, that's where you start to become a statistic that grows, and that hopefully is something that we can start to see a decrease on, with more programs and features and talking about mental health issues and the science behind it as well too.
Yeah, thanks for saying that, because it really helps hearing from someone who's been through it, and knowing that there is help out there, and that there are others out there that are experiencing what you've been experiencing. So thank you so much, Richard, for offering that, because I think it helps so much. And then in addition to all the things from Wounded Warrior Project, there's a couple of things, resources from the American Psychiatric Association that I wanted to make sure I highlighted. One is the APA's Find a Psychiatrist feature, which is available on the APA's website, psychiatry.org. And also there you can find APA's new series of explainer videos covering common mental health issues like PTSD. Those are both in English and Spanish. So a lot of resources to help you or help family members trying to understand what their veterans are going through. And then not just for APA, but a national resource in general, there's 988, which is the new National Suicide and Crisis Line. So if you or a loved one are experiencing a mental health crisis, it's not just for veterans, but for anyone, you can dial 988 at any time, day or night, to connect you with a crisis support. Or you can text the Veterans Crisis Lifeline at 838-255. And finally, for the doctors in the audience, APA members can access a fantastic collection of free online courses to learn more about treating veterans and service members and their families at the military and veterans section of psychiatry.org. So just a couple of resources there that the APA has, in addition to all the wonderful resources that you all have mentioned so far. A couple of questions from chat, and I'm wondering, particularly Aaron and Richard, if you could address this question: how can civilians support veterans who are struggling with mental health and access to care? Those who have family members, and then what about those who are not directly related to a veteran? So for those who have family members who are veterans, Richard, I'm wondering if you could talk about that a little bit. How can civilian family members and friends support veterans who are struggling with mental health?
Well, my own family is a great support system that actually doesn't do much, and that's what I have basically told them. I don't want them to be overly involved and find out, how am I doing today? How am I doing yesterday? What do I need help with? Having that coddled feeling is something that, as a military member, I think is something that it just really gets to you. So just knowing that you have a support system there, if you need it, is, I think, the biggest thing. Just not brushing them away and saying, you know, oh, you're fine. You'll be great. I'm here if you need me, but, you know, not trying to, you know, wipe your nose for you, if you will. You know, to take care of every little thing. We're a proud bunch. We joined, we served, and we're you know, trying to deal with it a little bit on our own still. But just knowing that if we trip, we got somebody to help us pick us up too.
And then, Erin, can you talk a little bit about how people who aren't necessarily related or know veterans, how they can help?
Yeah, I think that's great. I think even just asking that question, it shows what a great place that individual's coming from, that desire to help. And I think there's a couple ways that, you know, civilians or people that don't know veterans can help. One is being willing to listen. You know, and this is true if you have a friend who's not a veteran that's struggling with mental health, you know, concerns. No one's expecting you to be their mental health therapist. What they're, you know, what the expectation is that kind of non-judgmental listening, that willingness to help them make the phone calls they need to make in order to access the care. That can be sometimes a frustrating experience. So having somebody walk alongside you is great. I think if you're looking to be, you know, an advocate and an ally, I would recommend taking a course that's, you know, typically offered in your community, such as mental health first aid, or a suicide prevention / intervention course that gives you, again, this isn't, you know, a way for you to become, you know, a mental health therapist, but it's a way to get an understanding of, you know, various mental health challenges. Gives you an overview of what somebody with depression might be looking at, and it, you know, gives you an overview of what somebody who might be struggling with suicidal thoughts will be looking at, and it arms you with information so that you can be that support and that advocate.
Yeah. And then one of the other questions that came through was what can active duty military members do, and where can they get help? So a couple of resources that I wanted to highlight on that level. The military provides a variety and multiple layers of support for mental health. There are military family life counselors, also called MFLEX, because, you know, the military loves their acronyms. Every military installation, you know, large and small, typically has access to military family life counselors. Chaplains are another resource. And then there are multiple different types of therapists available through the military health system, from social workers to psychologists to psychiatrists. And in most cases, military service members can self-refer to a mental health or behavioral health clinic on the installation where they're working, wherever their, you know, nearest military medical treatment facility is. Again, if you want to access the military family life counselors, chaplains, you can do so on your own, or you can ask your doctor for a referral. That's also another way. And then militaryOneSource.mil is another really great resource if you're looking for different places to access care. Family members too have access, whether at the military medical treatment facility itself or through TRICARE. They can access counselors and therapists, psychiatrists and psychologists in the community as well, who take TRICARE, which is the military's insurance company. So lots of different resources available, and militaryOneSource.mil is a great place to start to look at under the health and wellness section of that website, to look at what mental health resources are available. And with that, I know we're running up on time here. So I wanted to thank everyone who joined us today, and thank my fellow panelists, Richard and Erin, for this important conversation to help shed light on veterans' mental health and the resources available to veterans and their families. So thank you so much for your time, both of you. Really appreciated chatting with you today, and look forward to seeing you out there.
Absolutely. Thanks for having us. It's such an important conversation.
Yeah, thank you very much. Hope you guys have a good day.
You too.
Take care.